Now it's on. All right, everybody, I'm gonna ask for your attention. I am Jackie O. Shumway, as most of y'all know me, and we have got an incredible panel for today to talk to you about women's health and life state support, hormonal harmony, hormonal harmony. Everybody needs hormonal harmony, yes, I think we all, okay? And and they're gonna talk about it from fertility to menopause. Our three speakers are gonna be, and I always say, she has a beautiful name, Nan Ray, and I said, name's so beautiful, I can't say it as pretty as her. Yes, look at her, okay? She is, she's a licensed acupuncturist, and, she also happens to be married to a guy who's at Fresno University, but he actually is, right? Actually, he's married to her.
Yeah,
okay?
there you go.
So, not really, she is a third generation practitioner of Chinese medicine, earned her Bachelor of Medicine from oh boy, this is a good one. Say it for me.
Yes, 黑龙江.
Heilongjiang, okay, here we are. University of Chinese Medicine in '98, and her Master of Medicine from Beijing University of Chinese Medicine in 2002. With several published texts, she is a highly qualified practitioner. She holds a National Certification Commission for Acupuncture and Oriental Medicine, which is NCCAOM, those who know that. And she is a licensed acupuncturist in Colorado. She currently runs a private practice at CCMU and on the campus, and she has dedicated recent years to a careful and thorough study of classical Chinese medicine texts, gaining insights beyond what is typically found in textbooks. She has achieved excellent treatment results for a variety of diseases, okay? Then we also have, Rebecca Hitt, who is also a licensed acupuncturist, and she is graduated from the International Institute of Chinese Medicine in Santa Fe in 1998, same year as you graduated from that big long name in China, okay? Yeah, she has been a practicing acupuncturist and Chinese herbalist for over 25 years in Paonia, Colorado. Okay, kind of cool, right? Now we know to go to Paonia, you know, look up, okay? She is also the founder of Blue Dragon Herbs, a Chinese herbal medicine line she has been developing for over 10 years. Her specialties include detailed consultations and custom herbal formulations for all kinds of health conditions. Okay, and then I gotta tell you this, I don't have anything on you.
For me?
No, but you mind telling us a little
Sure.
bit about you? So I will tell you who this is. I can tell you this much, okay? Erica and I have not met before, but she's Erica Craven Lyons, and she's a licensed massage therapist. So she's gonna speak from that. Do you want to tell a little bit about you?
I will, thank you. My name is Erica, and I was really just here to moderate the discussion between these two ladies. And then it became such a fun discussion, and we're running this a little bit more like a discussion than a lecture.
Well, I'm gonna leave this up to you there, because that's perfect, okay? No wonder I didn't have explanation. She was just gonna be the moderator, and look what these typical women, they change things at the last minute. I'm gonna let you take over.
We'll take that one. Yeah.
All right.
Yeah. It is on.
Okay.
Okay, we'll turn it off for a second.
Yes.
You're gonna start. Right?
So in preparation for this discussion, we really put our heads together and tried to come up with some questions that lots of women have about their health, and then try to answer them from Chinese medicine perspective, excuse me. And to start us off, I think the first question I'll ask both of you is, how is it that I can feel off? I can feel something that's not right, either mentally, somewhat physically, I can feel that, but going to the doctor, having blood tests done, having urine analysis doesn't really reveal anything that is out of the normal range in that system. And yet I experience, when I get treated with Chinese medicine, just there's always something to treat. There is almost always something to bring about change, better balance. So if you both just take a chance.
Sure.
I go first.
Yeah, you go first. You want to?
Great.
Here, you need the microphone too.
Hi, everyone. Say hi to you. Okay, so for this question, I always think about the live exam, whatever the imaging or body liquid exam is focused on diagnosis disease. If you go to the hospital and the doctor say, oh, that's abnormal, I'm so sorry, it's real abnormal. Yeah, you already have a disease. You need to get a serious treatment. So, but the range, standard range is for the science. They are not for the population. Statistic, data. It's not for the individual person, and that is why for Chinese medicine, like today, I see the 10 people, everybody I can see abnormal, okay? That is not to say you get illness, you have a disease. That is means you're imbalanced. So for Chinese medicine, we can treat everything, but we only use the one way for what? Regular your situation and looking for what is close to perfect balanced. But trust me, nobody perfect, right? Yeah, so this is my, so that's why Chinese medicine, when we treat patient, we always see what happened inside. We not only see the data or imaging. Yeah, so.
Okay. Hi, everybody. Can you hear me? Yeah. Thank you for that. So one thing I was going to say about when she said about blood tests is the blood test ranges are usually average for the population. So it's not actually an optimal health range. It's an average. And we're not really, we're looking at the body differently. We diagnose on patterns. We have a slightly different approach, which we'll talk about. But Chinese medicine is based on patterns. And so if we ask enough questions, look at the tongue, feel the pulses, then we see what the imbalance is out there. And we might look at a blood test, but mostly we're using our understanding of how we're balancing. And so, we might say, oh, you're Qi deficient or you're blood deficient. And that may or may not, like, for example, a lot of times I'll see someone, I'll say you're blood deficient means the blood is a little weak. Maybe there's not a lot of it. And then people will say, but I'm not anemic. My doctor doesn't say I'm anemic. I'm like, well, but you're still blood deficient from Chinese medicine standpoint. So we diagnose, we look at symptoms and the pulse and we put everything together and make our own diagnosis. And then we bring the body back into balance with acupuncture, herbs, and other therapies.
Excellent. Thank you. As a follow-up question, what are some of the patterns that you see particular to women and being out of balance? And perhaps a case study, or could you share with us a way that you worked with all of these different tools you have to restore balance to the individual?
You go first.
Really?
Yeah.
My back on here.
Uh-huh.
I mean, yeah, there's a lot of examples. I mean, I guess menopause is probably one of the more common situations, or menstrual issues. I'm sorry, my brain is like, what do you want me? There's so many things I could talk about. So yeah, we diagnose on patterns. So let's say somebody comes and they have menstrual irregularity, let's say, and they have a lot of menstrual cramps. They, feel really awful, headaches, migraines during period, pain. You could come to an acupuncturist and they would diagnose that and say, okay, maybe, in my language, I might say, oh, you have a blood stagnation or something. And so I would do acupuncture points and I do a lot of herbal medicine, and I would do herbal medicine to help balance that situation. And I mean, I guess from a case history standpoint, I just had a woman who, she actually was on hormone therapy 24/7, like 7 days, all month long. She wouldn't stop it because her periods were so intense that she was so sick and in so much pain that her doctor just suggested she never stop her hormone therapy. So she never had a menstrual cycle. And then she came to me and I ended up giving her a formula to kind of work on that, what I would call stagnation, so that she wouldn't have that pain. And the next time I talked to her, she had now started her cycle, and it was like the first time in 2 years she hadn't had any pain with her cycle. So.
That's incredible. Thank you.
Yeah, for me, my specialty is through the pulse and tongue to check what happened in the body.
Mhm.
I check the energy flow. I say the energy flow, actually, we can say the qi flow, okay? That is not only include, only related energy, also related all of the circulation. For the model word, we call the metabolism. Yeah, so when we say I check your energy, I check the whole metabolism situation. So yesterday I talked with my husband. He built up this Expo. I say that is totally right time, because in the world, the physics, the classical physics to recognize the word, they changed the mind to model physics. Before, the people recognize the word from the material, truly material, like a mechanism, okay? Now they tend to the field, F-I-E-L, field, okay, field and energy. Now, what is the popular for physics? Quantum. Quantum means what? This year, Nobel, last month or this month, Nobel Physics Award is, the topic is the quantum tunneling. It means the particles can through the potential barrel, even the barrels high energy or higher than these particles. That is totally match we're talking about the qi. So it's very interesting. Ancient, not only Chinese ancient, actually the whole world, the civilization, ancient civilization, recognize the world depending what sun and moon, right? They recognize and they build up calendar. Doesn't matter which culture, which country's calendar, always related to sun and moon circulation. Yeah, so that is just a match Chinese culture yin and yang. So yin and yang related what? What is the yin and yang? It's an energy situation. Yang energy is related activity. So yin energy is related nourishing, peaceful. And when we see the whole world, I say, oh, yang and yin, also we see what we have. Now we have a lot of things. But in ancient China, we only have a mountain, we have water, we have metal, right? We have a tree, and what else? Fire. So that is called 5 elements. That's 5 elements, what they see. They don't have, lights, right? So they don't research the electrolytes. So depending on those 5 elements, they separated the whole universe into the 5 parts, and they figure out what is the relationship, even the planet, right? The old astronomy have a 7 planet. You know what is it? Okay, forgive my English. Okay, so that is just the yin yang 5 elements. And all of the planet work for the earth, okay? Also work for water, like tidal ocean tidal water is related planet reaction, right? Body, same thing. Body is a piece of, scattered. So Asian people, okay, Chinese ancient, they research the 5 element relationship to figure out what is the rule for the universe. Think about, right? You with your family, it's always what? Love or hate, right? We call the generation and attack. So 5 elements has the relationship like that. For example, wood, tree, okay? Tree is mother of the fire. And also wood account the earth. So for example, like that. So that is also described what energy relationship. So when I treat a patient, I use that simple rule to balancing the internal energy. And how can I to check the internal energy? I use the pulse and tongue. I always told the patient, you know, thousands years ago, in China, we don't have imaging, we don't have a blood work. How can we see what happened inside? We check the energy from the pulse and tongue. Talking is sometimes cheating, but pulse and tongue never be cheat, never be. If I see something wrong, it's a big problem. Yeah, so this is my method. And I told the patient, see, like we pick up the watermelon. We don't need cut every watermelon, see, oh, that's good fruit or not good fruit. We just see what pattern, what color, what shape, and knock the watermelon. So I know all of the elements together. I say, oh, that is juicy fruit. So I told the patient, I told my student, patient just my watermelon. Yeah, I want this watermelon is inside the circulation perfect and they're refresh, they're delicious, they are be balanced. Okay, so for women health, yeah, I treat my 80% patient is a woman. So my mom is a specialist for Chinese medicine, gynecologist. So when I was young, I know this is my fate. I will work for women, work for their family, husband and kids, okay? So how can I, so that's why I like the energy balancing method. For example, painful period. I also have a twins, you know, girls, both has the painful period. So I check the pulse, I get different diagnosis. One girl is more weak, we call the spleen qi deficiency. One girl opposite is we call the liver qi stagnation. Twins very interesting. They are just like a coin, double side. They are same time born, but totally different, right? Yeah. So painful period. If the other regular treatment, pain pill for everybody. Okay, maybe some hormonal like birth control pills, that's it. But for Chinese medicine, I totally understand two girls different, even the same day birth. And very interesting, her mom also have a painful period. After I treat both girl healing, release from the pain, her mom say, I hope when I was young, I can meet you. Her older than me, I think, yeah, when I saw her, it's around 50 something. Her teenager age, doctor only say, give you salty water. Yeah, nothing help. But now for Chinese medicine, 1,000 years ago, we already have a method how to regulate period, how to stop the pain. And also, I have a lot of the case for the gynecology, for menopause. Yeah, I'm menopause time, so I want to share the experience for you or how to take care. Never do cold thing. Even room temperature. Patients say, oh, you know, I'm good. I never drink cold thing. I drink room temperature. Sorry, room temperature is cold. I always told them in the body temperature higher, right? Internal temperature higher than superficial. Do you like do every hour you soak in cold water? If you don't like a cold bath, internal organ doesn't like it. So if you drink even room temperature water, your organ water feel cold and consume more energy or cause the blockage, because water, ice cold, ice caused water contraction. So menopause women or all of the girl or all of the women should be kept warm. And we understand close or after menopause, we can wait a lot, especially lower abdomen, right? So general Western medicine say, oh, that is a hormone imbalanced. That's true, totally. From that, Chinese medicine with the Western medicine, same page. But for me, it's related low energy in lower body. We don't have much energy here. So body try to protect us to gain weight, to keep the worm. So if you want to lose weight, it doesn't matter man or woman, okay? So you always need to keep the body warm. Some theories say, oh, you need to keep the cold because the cold consume energy to help you consume the fat. No, it's maybe temporary, but long term, if you cold, your body say, I need a jacket, gain weight to protect the internal organ, okay? So yeah, so for women, I say no cold at all, always, and also reduce the sugar. Sugar increase the inflammation. So that is make us skin not beautiful, okay? Yeah, and also sleep, very important. I just told you, right? Sun and moon. Sorry, I talk too much. So sun and moon, okay, circulation. People say, I can sleep 12 hours. What time you sleep? If you daytime do sleep, sorry, it's not healthy. You interrupt your cycle inside, okay? So, yeah, okay, too much on top.
There's so much to say.
Yeah, too much said.
No, that was
If I
great.
could just draw that back, so you did a wonderful job of painting this picture of how these energies shape the entire world, not just the body,
Mhm.
but everything around us, and how you go about restoring balance to that natural system, which I think is great.
Can I just add one thing?
Please.
So when she was talking about the elements, one thing that I like to say to my patients, or I find myself saying a lot, is Chinese medicine is like weather forecasting for the body. Because we talk in these terms of like hot, cold, dry, damp, wind, and these are the patterns. And basically they're observations in nature that were then applied to the body. And so, yeah, that's something that, yeah. So, yeah, so we are very much affected by our environment, and, you know, sometimes we don't really think about that, but some people are very much affected by the too much heat or too much cold or the rainy weather or the wind. And when you start to pay attention to which of those elements are throwing your body off, that's starting to point to where your imbalance is. If that makes sense. If you get too hot, there's a chance that there's, you know, an imbalance in your body that's contributing to that. Or if you get cold easily, there's an imbalance there that we can treat. How are we doing on time? We got some time.
Is it safe to say that if we don't treat these imbalances, if we go for a long time with chronic imbalances, that those turn into disease, turn into more serious problems? Is that a fair assumption?
You go.
Long-term chronic imbalance?
Well, I would say that, yes. I think the longer that you have an imbalance, the chance it has to create another imbalance. The body is so connected. So she was saying like, oh, the liver wants to be mean to the spleen. So, but also if you have a spleen deficiency, it makes it easier for the liver to overact on it. So these patterns, yeah, if you have, let's say, a Qi deficiency left untreated, that might turn into a blood deficiency left untreated, you know, so they definitely can, would you say the patterns can increase?
Yeah, definitely long-term imbalance always cause a big problem. Definitely, like the cup have a small, fragile thing. If we're not fixed, they will be getting bigger and someday collapse. So that's why the pose very interesting, energy very interesting. So some people, they say, I'm good, I'm okay, I'm very healthy. But when I check the pose, not right. Even they don't have symptoms, it's not means they are healthy. And you can see a lot of people, they are, they look very energetic, right? Exercise a lot, but suddenly they get big illness. That is meaning they have the long-term imbalanced, but they don't know, even the exam didn't show. But sometimes the mountain collapse, yeah. So for women, I say, woman is a flowers. Doesn't matter what age, different age have different beautiful thing. But we need water, always moisture, always warmth. Drink water, girls, okay? Yeah, drink the waters. And we need love. So we are so refreshed, okay? We're good, we're beautiful, so we can share the beautiful to other people. So moms, please take care of yourself. Don't make you imbalanced too long.
That's great.
So I actually want to ask you a question, which is slightly off topic, but it's still in the theme of treating women. And we were talking last night, and she says that when she treats children sometimes, that she will actually just treat the mother instead. And can you talk about that?
Thank you, give me a chance.
Yeah.
Yeah, she already know that. So this is a real related quantum, internally, okay? So it's very funny story, yeah. General, we thought a little baby very close to mom, okay? So we treat the young kids from the mom. I need a mom for kids. Yeah, I have lots of cases. For example, one time I treat a girl get high fever. So I check the temples. I said, oh, you eat sugar too much. I need to needle you. And she's crying. She said, no, I don't want needles. Who like needles, right? So, and I say, okay, I can treat you, mom. So I check mom's pulse. I make the decision what point I should do. And after 15 minutes, the girl's vomiting out. I say, I got it. Yeah, vomiting out. It means what? Detoxic. She get a common cold, high fever from what? Food retention, with the sugar too much. Clear up. It's good. Second day, her parents call me and say, oh, she's fine. She go to school. Yeah. And this is a very common case. Okay, I have the kid. She until to 2 years old, he didn't growing up. He didn't gain weight. The doctor almost sent him to social worker. That scared their parents. So I take it a very long time, monthly. I treat mom, and then she can eat. He can eat. He doesn't want to eat. The reason is he only want to drink milk. He doesn't want to chew the real food. Okay, so I treat her mom to help him growing. Okay, the teeth, the heart, the brain to close to food, like the chewing the food. After a few months, he's fine. Yeah. But the most interesting thing is one time I treat an old lady, I forget, lower back pain. And her daughter is my friend, very close to me. We are in same room. And after the treatment, my friend said, oh my God, where's my rashes? When she came in, she has rashes, okay? But after I treat her mom, her rashes gone. So that is teaching me what? Doesn't matter how little kids, if this kid very close to mom, even she's 40 years old, still have what a connection. Amazing. Yeah, it's not only me. Okay, a lot of practitioner, my friend in China were here, they do that way. So yeah, and now I do more advanced technique. I just put the cis sticker on the point, lasting longer time. It's energy worked. Yeah, very good.
Do you have another? I was going to say something else. I was just going to say, just kind of broadly, if you were to say, like, how can Chinese medicine help women? And if you started even just from pregnant, I mean, it can really help everything. And I just was she made me think of like, oh, the women and children. I do a technique called Shoni Shin, which is a Japanese technique of like kind of tapping on the meridians for treating children. So you can start doing Chinese medicine. The first time the youngest child I've ever treated was 1 day old that had a rash. And I just did like little tapping and it went away within a day. So as moms, it's like you can also do Chinese medicine, acupuncture, and herbs during pregnancy. I've treated lots of pregnant women, sciatic pain, acid reflux, all kinds of discomfort. You could treat women during the delivery, you can put in points or not, maybe during labor, you can help with that. You know, you can just kind of keep going. You know, then you have, you know, menstrual issues, puberty, fertility issues. There's, you know, that's probably pretty well known, but there's whole fertility clinics based on, you know, Chinese medicine and helping women get pregnant, menopause, and also aging and longevity. So really, you know, from birth all the way through, there's somewhere in there that Chinese medicine can be beneficial.
May I add one thing? Because today topic is related women healthy, so I want to add one point from my opinion. So for women healthy, the local lower abdomen circulation include the blood and the energy circulation, very important. So I want to share with you, for example, like endometriosis. People take the surgery, right? If we not change the local, the root energy, okay, circulation, endometriosis will be come back again and again. Or like a cyst, right? People say, okay, I can do the clean. It's so easy. Right now, the surgery technique is so amazing. Sometimes I say they use the spoon, take off, no pain. And after surgery, you go home, no problem. But if we are not change the local circulation energy, okay, will be come back. So if you have friend, especially for women friend, if they have a cyst, endometriosis, PCOS, you know, not surgery is not a help. It's a rescue the life, like bleeding a lot. Okay, do the DNC, totally immediately stop bleeding. Okay, but for surgery, if we don't change the root, will be come back. But for dysfunction bleeding for Chinese medicine herb, sometimes, okay, one bag is will be stopped the bleeding. From my mom's experience, my my friends, you know, I live in from the Chinese medicine family. I see a lot of miracle. But what is the important? You need to trust. You need to trust the practitioner what do for you. Okay. Thank you.
Great.
Any
We
questions?
have time for 1 or 2 questions, if anybody has something out there that we can get to. No?
Anybody? Oh, there we go.
Patterns that you see with menopause or hot flashes?
This is very good question. So general for hot flash, night sweating, this is a common symptoms for menopause, right? So people, we call the yin deficiency. Yin deficiency means what? Lack nourishment. So dry heat comes up. So especially this hot flash, night sweating happen in the night. Okay, one of situation, nighttime. It means what? We lost the nourishment. So yin deficiency. And one situation, patient say what? I feel hot flash. After that, I'm frozen cold. Think about how many women say, nighttime, I'm so busy. I feel hot. I clear up. And then I feel cold. I cover me. How to say? Open, cover, open, cover. Yeah, right? So for and for the, how can we diagnose it from time to post? Okay, we have a very exactly technique to immediately recognize yin deficiency or yang deficiency. The thing in deficiency, we have the, you know, 2000 years ago, we have formula to nourishing the body. Okay, for yang deficiency, very tricky. Patients say, I feel cold, why I drink, I feel hot, so hot, I have sweating 10 times a day, why I'm drinking warm water? I told them drinking warm water, right? They thought I'm evil. How can we do? But I told them, you create heat and then you feel cold. That means what? You have part of cold sensation in energy in the body. We call the yang deficiency, right? So why you, after treatment or after treatment, the patient say, oh, I feel better, but I still have some hot flash. I'm 100% sure that heat is from the cold. I told you, patient body feel cold, body create heat to warm up you. So I have very funny case. My patient coming to see me say, you know, sometimes good, sometimes not good. Like today, I'm fine. Yesterday, I'm not good. I asking her, yesterday, last night, what did you eat? He said, oh, I drink soup. I say, day before what you did. Oh, I take the ice cream. Ice cream caused the heart, right? I told her a lot of time. Finally, she get it. So she quit all of the ice cream. Her flush is gone. Okay, so for Chinese medicine, treat a woman so easy, always yin and yang. So everybody know the yin yang pattern, right? So think about what is that? Period cycle. Period cycle, bleeding is what we lost in nourished thing, right? So after the bleeding, yin start growing, right? And growing go to where? Go to the ovulation time. Change. Yang start, after ovulation, yang start growing. To the before period, yin and yang so full. If you not get pregnant, release again, release. So that is period cycle, yin and yang. For Western medicine, what is it? Before ovulation is the estrogen growing. After ovulation, progesterone growing. That is also yin yang pattern, right? Just a different name. That's why Chinese medicine, that's why my mom chose the easy theme for me, easy career. We just regulate yin yang energy, qi and blood. We got it. That's it. I'm so sorry. Look like I'm so miserable, right? No, not at all. Yeah, Chinese medicine not complicated. Very healthy.
Any other questions? Anyone?
Say what helps a woman to become balanced. Any practice that would help a woman with the journey to become balanced.
Use the practice like an exercise?
Yeah, can you repeat it? Like you said, which practice or?
It means more exercise. Practice, it means the exercise or diet thing or include everything. Everything, okay.
Or she said, what's the one big thing or to help with balance? Warm water.
Keep body warm. Keep body warm means what? Your yang qi, your activity. So think about when we getting older, we what? We getting colder. We like the jacket. But when we 18, 16, always what? Open shoes, shorts. We have a lot of yang qi, right? Activity qi. So keep you warm is the biggest thing. Everybody like now knows now is how popular surgery, right? The injection surgery for the skin, for the cosmetic,
Cosmetic, yeah.
cosmetics. I would think about that, that is so physics. Okay, well, I have wrinkle, okay. Oh, make it tight. I sluggish, I do lifting. But after I read an article, when we getting older, okay, the bone deform, right? Finger deform, arthritis, we need to change the hip, knee, ankle, joint. How many people around you take this surgery? From what? Yang qi sluggish, not much qi support the bone. Head is the same. So you just work for your skin, for your muscle, not for your bone. Oh, will be terrible. Your cheek is here, but your eyes is here. Do you understand me? That's the surgery. Sometimes not get a good result because the bone deformed. How can we support the bone structure, tonify, warm your kidney, your lower back, your lower body? This is a root. This area is a root of the body. So we need to keep it warm to make us what? Very rooted, sedate. When we getting older, you can see we're not, we're what? We're scared. We're not stable. The young kids, they are always, it doesn't matter, right? I don't care. But for us, we say, really? How about my kids? They didn't call me this weekend. He's okay? We're not okay? What? Not rooted. Okay, so keep warm, make you what? Rooted, and the mind should be clear. But now people growing what? Down, how say, up, down side, you know, like, yeah. You guys so nice, just like my student. They always know what I want talking. Yeah, so we mind is so busy and we legs so weak. So keep you warm, keep the yang qi. Exercise is not exhausted exercise, just warm up your body. We'll have time.
So good.
Yeah.
I was actually,
She's taking the mic.
I'm gonna take the mic at request, okay? Would you teach everybody, if y'all wouldn't mind, stand up and teach them how to warm their kidneys? Would you kind of show them that? Give me some practical to take home, right? Okay, want to show, here you go. Show what we do.
Mom, you can stay down, whatever you want to do. You want to come up here or no? Taking your shoes off you?
For this panel, I wear the high heel, but see, I'm overthinking. Very easy, so easy. So just separate your feet like the shoulder. So quiet, okay? Let me see. Inhale, your arm is up. Exhale, the hands down, and you make the chi to the lower abdomen, like under, how say?
Belly button?
Umbilicus. Yeah, like this life under umbilicus. Here we call the Guanyuan point, we call the Renfu point. This is the root of the qi. So Taoism always focus on practice qi, this area. So do 3 times, inhale, exhale, the qi stay here. Another thing.
Is that right over left for women, left over right?
No, it
No, same.
doesn't matter. That doesn't matter. Later, when we finish, is thank you for mentioning about that. And use the right side to how say hold your low waist and do. Let me see. Go this way. Here. Inhale. Exhale. The how say this level, and this hand go this way. Let's see. Yeah, hold this way, hold the hand and go this way. Yeah. Inhale, exhale. Yeah, go this way, hold cross the whole. Yeah, and go this way. Hey, hold on. Oh, go this way, sorry. Inhale. Exhale, go this way. Exchange, yin yang exchange. Yin yang exchange. Do you feel a little bit body warm? No? You
It's
have-
cold in here. We need to keep doing it, right?
What's really neat about this is, guys, it's good for you too.
Okay,
Yeah.
so you can keep doing that. It's, that is work for what? Work for your lower back. And those, you can see it's just like a yin yang pattern. That is a qi energy movement. So when you're tired, where you have the sweating, like me, I didn't do very much, but I already have a little bit of sweat. This sweat, we say the detoxic. And then you do same thing. So the man is the left hand in the lower And for woman, right hand in the lower. Okay, you do 3 times. One more. And put the both hands to the umbilicus. And when you inhale to turn the right side, left side first to circle to make the qi go in the body. Yeah. When you inhale, the hands up. Exhale, hands down, like this circle 7 times. And then you make the qi go to the body. And for another way, after 7 times, okay, we do the another way, opposite. Yeah, still inhale goes up, exhale down. So 7 times, okay? Yeah, that's it. Yeah, I know I'm maybe not clarifying, but I just, I also see the Joe here. Joe, you can teaching the people more detail. Yeah, he's the master. He's very good for the
And we will be doing more Qigong tomorrow.
Yeah.
Great. Wasn't that good?
Yeah.
I have to tell you, I asked her to step out of her normal realm. That was great. Thank you.
We have a little bit of a break, folks, and there is food